Chapter 8, Joints. So Chapter 8, Joints, this is just showing you an outline of what we're going to go over. So joints are going to contain flexible connective tissue, and that connective tissue, of course, holds the bones together while permitting some degree of movement. Which is going to depend upon the joint classification. So you have joint classifications. We're going to talk about fibrous joints, cartilaginous joints, synovial joints, types of movements at the synovial joints, types of synovial joints, factors affecting contact and range of motion at the synovial joints, selected joints of the body, aging in joints, and arthroplasty. So these are some of the topics we are going to talk about in Chapter 8. So, of course, a joint is also called an articulation. So it is a point of contact between two bones. So it does hold the bones together in ways, of course, that are going to allow movement. You do have, of course, articulations between bone and cartilage, and also you have articulation between the bone and teeth. Arthrology is, of course, the scientific study of joints. Your kinesiology, of course, is the study of motion of the human body. Okay, joint classifications you have is going to be based on two criteria. So the first criteria is like the type of connective tissue that holds the bones together. And the second criteria is going to be the presence or absence of space between the bone. So first you have fibrous joints. These are bones that are held together by dense collagen fibers. Cartilaginous joints, which are bones that are held together by cartilage. And synovial joints, which are bones held together by ligaments. The functional classification of joints, first one is your synarthrosis, that is an immovable joint. Your amphiarthrosis, of course, is a slightly movable joint. So on this one, of course, the bones are connected, of course, by collagen fibers or cartilage. Diarthrosis, this is a freely movable joint, which is going to, the diarthrosis is going to permit the widest range of motion. The synarthrosis, of course, is the bony edges of the bones, of course, are going to be close together and may interlock. Fibrous joints, these lack a synovial cavity, so they lack a space. It is filled, if they have a space that is filled with synovial fluid. The articulating bones are held very closely together by dense irregular connective tissue. Fibrous joints permit little or no movement. You have three different types of fibrous joints. The first one here is sutures, and I'm going to go ahead and go over it a little bit. I have it on the next slide, but I'm going to go over it here while I have, of course, the picture showing. So these are showing sutures between the skull bones. So sutures is a type of fibrous joint. The sutures are only going to occur between bones of the skull. They have very thin layer of dense irregular connective tissue, and they are considered immovable. Okay. Then the other types of joints is syndesmosis and gymphosis. So the sutures we already talked about on the previous slide. Syndesmosis is showing you an example here of a tibia bone and a fibula bone. What happens here is it has a greater distance between the surfaces. It permits slight movement. It does contain an interosseous membrane that is between the two bones. You see it's a white part inside there. It's between the tibia and the fibula and, of course, in the leg. You also have interosseous membrane located between the radius and the ulna. So it is going to allow or permit slight movement. Gymphosis, of course, is an immovable joint. It's a joint in which a cone-shaped peg fits into a socket. So articulations of the teeth with the sockets, of course, the sockets of the maxilla and the mandible bone, that's really your only good example of that. Motion is going to be very minimal, but it can be achieved over time with braces. This one, of course, is also known as your dental alveolar joint. Because it does contain, of course, the teeth and the sockets. It is a joint, of course, that binds teeth to the bony sockets in the maxillary and the mandible bones. And, of course, you see your picture here. Next, you have your cartilaginous joints. So, of course, these are going to lack a synovial cavity. They allow little or no movement. The joint is, of course, tightly connected by either cartilage. So, the two articulating bones are tightly connected by either hyaline cartilage or fibrocartilage. Of course, there's two types of cartilaginous joints. You have your synchondrosis, which is shown you in this picture here. And again, we're going to use the example of the epiphyseal growth plate with the synchondrosis. And their symphysis, of course, is located here, and we're going to use the pubic symphysis as an example on the next slide when we talk about the symphysis. So your synchondrosis is connecting tissue is hyaline cartilage. An example of that one would be your epiphyseal growth plate. It connects the epiphyseus and the diaphysis of a growing bone. Again, that epiphyseal growth plate will eventually ossify in adulthood and become the epiphyseal line. They're located on your long bones and also between the first rib and manubrium. Next, you have your symphysis. These are slightly movable joint. The ends of the articulating bones are covered with hyaline cartilage, but a disc of fibrocartilage connects the bones. So our example that we're going to talk about, of course, is the pubic symphysis. That's the example for the symphysis. So all symphysis are going to occur in the midline of the body. Other examples, the pubic symphysis, of course, is between the anterior surfaces of the hip bones. It helps to connect those hip bones together anteriorly. Another example would be your intervertebral joints between the vertebrae. Those are considered symphysis. Another example would be the junction between the manubrium and the body of the sternum, which is located at the sternal angle. Synovial joints. Of course, synovial cavity allows a joint, of course, to be freely movable. It has a space between the two articulating bones. Ligaments, of course, hold the bones together in a synovial joint. The synovial joints are going to be the most common. And they're also going to have the most movement. So some things to know, of course, about the synovial joints, of course, are the articular capsule. Of course, that is going to be a sleeve-like capsule that encloses the synovial cavity and unites the articulating bones. The articular capsule is going to be composed of two layers. Those two layers, it has an outer fibrous capsule and an inner synovial membrane. That fibrous capsule, of course, is flexible and it connects the periosteum, of course, to the bones. It also has articular cartilage on the ends of the bones that covers the bones at a joint, and it's like a hyaline cartilage, but it has no perichondrium, and its matrix contains more water, of course, than other cartilages. The synovial membrane, of course, is going to secrete synovial fluid. So that synovial fluid, of course, is going to lubricate, of course, the joints. So when part of an articular cartilage is compressed during movement, some of the synovial fluid squeezes out of the cartilage and into the space between the opposing surfaces. This thin layer of fluid markedly reduces friction between moving surfaces, just as thin film of water reduces friction between a car's tires in a highway. It also absorbs shock. So you have your shock absorption. So synovial fluid is going to cushion the shock in the joints that are going to be subjected to sudden compression or impact. The cushioning effect occurs because the viscosity of the synovial fluid increases and increasing pressure. So, for example, if you were jogging and your knees were severely compressed, and the viscosity, of course, of the synovial fluid increases as that pressure lessens, the viscosity, of course, is going to decrease, and the synovial fluid is, again, a lubricant. Next, you have nutrient distributions, and that's going to be like synovial fluid in a joint. must circulate continuously to provide nutrients and dispose of waste of the chondrocytes in the articular cartilage. It circulates, of course, whenever the joint moves, and compression and re-expansion, of course, of the articular cartilage pumps the synovial fluid into and out of the cartilage matrix. So you have arteries, of course, that supply oxygen and nutrients, of course, to the cartilage. And then you have veins, of course, that are going to remove carbon dioxide and metabolic waste from the cartilage and take it out. Okay, this is showing you a picture of a synovial joint. And if you notice here, you have the two layers of the articular capsule here, and it's your fibrous membrane and your synovial membrane. And this is just showing you the typical structures of a synovial joint. The yellow part here is the synovial fluid. Okay, so one thing I always like to tell people about is when someone's exercising and they're what they call warming up, what that means is it helps them to produce more fluid, which means they're going to have less stress on the joints or more fluid moving around. Cracking of joints, if you hear somebody pop in their joints, or what they call cracking of the joints, the noise theory to that of what causes the noise of that popping sound. The theory is that the bubbles form in the joints from that synovial fluid and burst due to the suction of the cavity. Next we have of the synovial joints, we have accessory ligaments and articular discs, which you do need to know. The collateral ligaments of the knee are your tibial, collateral ligaments, and I'm just going to abbreviate that CL. And then you have your fibular collateral ligament. Okay, so both of these are going to lie outside of the articular capsule, but they're named after, the ligaments are named after the bone that they're attached to. So the one that's attached to the tibia bone is called the tibial collateral ligament. It's also known as your lateral collateral ligament. Medial, excuse me. The tibial is also known as your medial collateral ligament. The fibular bone, of course, is known as the fibular collateral ligament, is also known as the lateral collateral ligament. So I apologize for that mix-up. I caught myself. So the tibial collateral ligament is also called the medial collateral ligament, and the fibular collateral ligament is also known as your lateral collateral ligament. So they are attached on the sides, and they are located outside, of course, the articular capsule. You have, and they refer to those ligaments, of course, as accessory ligaments because what they do is they support, strengthen, and reinforce the synovial joints. Anterior and posterior cruciate ligaments of the knee. It's another accessory ligament. So what they call the cruciate ligaments, they run, of course, through the interior of the knee joint and are called, or examples of what they refer to as intracapsular ligaments. Okay, but these are the ones that you call known as your ACL and your PCL ligaments. And they're going to lie inside that articular capsule. Next, you have your menisci, or the meniscus, for plural, is menisci. Pads of the cartilage, of course, are going to lie between the articular surfaces of the bones. It allows the bones of different shapes to fit together more tightly. These are going to be made of fibrocartilage, and they're also known as your articular discs. So a pad is a pad of fibrocartilage between opposing bones within a synovial joint. What they also do, they subdivide a synovial cavity in the channel of the flow of the synovial fluid, or allows for variation in the shapes of the articular surfaces. Nerve and blood supply. You have nerve endings convey information about pain from the joint to the spinal cord and the brain for processing. Other nerve endings respond to the degree of movement and stretch at a joint, because you don't want to overstretch a joint or a muscle. So the spinal cord and the brain, they may respond by sending impulses through different nerves to the muscles to adjust the body movement and prevent overstretching. Arterial branches from several different arteries merge around a joint before penetrating the articular capsule. And again, these arteries are going to be delivering oxygen and nutrients to the joints. The veins will remove the carbon dioxide and waste from the joints and move it out. So bursae and tendons, bursa. What it is a small, thin, fluid-filled pocket that forms in connective tissue, usually outside of a joint capsule. It contains synovial fluid and is lined by a synovial membrane. Bursae often form where a tendon or a ligament rubs against other tissues. So it's located around most synovial joints, including the knee joint. Bursae also help to reduce the friction and act as shock absorbers as well too. So we do call them sac-like structures, of course, that contain the fluid, similar to the synovial fluid. And I did talk about where they are, of course, are located between tendons and ligaments and bones. They're also going to provide cushion of the movement of these body parts. Tendon sheaths, these are tube-like bursae. Of course, they wrap around certain tendons, of course, that experience a lot of friction by helping reduce friction at the joints. And examples of these are tendons of the biceps. Okay, some checkpoint questions is define a sprain. That is a forcible wrenching or twisting of a joint that stretches or tears its ligaments but does not dislocate the bones. It does swell though. Define torn cartilage. Torn cartilage, of course, is when you have tearing of the articular discs, so the menisci disc in the knees. This can cause arthritis later unless the cartilage is removed. Define a strain. A strain, of course, is a stretched or partially torn muscle or muscle and tendon. These, of course, are going to occur when a muscle contracts suddenly and powerfully. Define bursitis. Remember, itis usually referring to inflammation, and burst for bursae or bursa. So it's caused by repeated irritation or exertion of a joint. It's caused by trauma. It can also be caused by infections. Usually people treat your bursitis with anti-inflammatory medications and steroids. Okay, so this will be the end of part 1.